Well, good day. I'd like to think that this might be one of my most important video clips to date. As you know, I had bilateral hip surgery performed on Monday. And in less than 24 hours after surgery, I managed to act like Superman and perform all of my fitness and mobility tests at the hospital so well that they discharged me. So I came home in all the excitement, feeling super good. But I made one mistake. A mistake that, in spite of dozens of people warning me not to let the pain get ahead of me and make sure that I was taking the pain medications and the other medications on a prescribed basis, I got distracted and missed the first two pain time thresholds. So when the pain started to appear at a level 1 or 2, it quickly climbed to level 3, 4, and then 5. And the problem with that is that I did take the pain meds, starting with the extra strength Tylenol, not the super strong pain relief med that they had prescribed. It did not kick in right away, and the pain continued. When it reached 10, which is probably the highest it could get, and the worst it has been since the surgery, I opted to move to the fast-acting narcotic, according to the description, which is probably in the Oxycontin family. So I took one of those, but it was about 8 o'clock at night, and it didn't kick in. So I just kept getting progressively worse to the point that it was torture, literally torture. I had almost an impossible task in getting in and out of bed. I had to go to the washroom. That presented a challenge, and I was struggling. So my word of advice, in spite of you getting lots of advice to take your pain meds, to take them on a schedule, not to let the pain get ahead of yourself, I learned a valuable lesson. And it took until morning, to be honest, for the pain meds that I started taking to actually take effect. So I'm now sitting at noon. It is Wednesday, had the surgery done on Monday, and I'm feeling back to being almost like Superman. I will later today engage in doing all of my post-op physio exercises. And I'll post a picture of the pain meds and actually all of the meds that have been prescribed. So you're going to get pain meds. Probably there'll be an extra strength one. It could be in the Oxycontin family. You'll get probably something like extra strength Tylenol or Tylenol 3, which is your preferred pain medication if you don't let it get away on you. You'll get something prescribed as a blood thinner. There is a risk of blood clots after any major surgery, so you're going to want to take that pill on the recommended schedule. You're also probably going to get to take, after the blood thinners have expired, 7 days, I think in my case, you're going to be put on a mild 81 milligram dose of aspirin. And that's just to make sure that your blood is thin. It reduces the risk of blood clots. You're also going to get in that prescription some kind of an anti-infection pain med. There is a risk of infection, as everybody would know, from surgery, and you certainly don't want to get an infection. So all of the pain meds should be taken on the recommended schedule. I was hoping to opt out of taking the Oxycontin high-level pain narcotic that is supposed to act quickly, but last night I did take one. And finally in the morning, the combination of the Oxycontin narcotic, the Tylenol 3 that I had at home already, I managed to get the pain under control, and I'm feeling back to almost being Superman. So that's my word of advice, and it may be the most important piece of advice I've been able to share so far. Signing off. Later in the day, I'll produce a video on the post-op exercises that I did yesterday at the hospital and will be continuing to do at home. Take care. Have a great day.